And to give a very, very brief one slide, what we see this about is working on many levels, as people have said already, about inspiring people to want to move more, about creating a city environment that actually makes it easier for people to move more, creating workplaces that actually value and support people moving more, because we know that fit and active workplaces actually improve the bottom line for employers, improves their business offer. And in fact, very much getting people back into work through being fit and active. We know that really works well. And a health system and a social care system that actually totally brought into it, with a commission around motivating people to be physically active is a key part of what they do. So that's part of what we see in the vision. But I'm now going to introduce a couple of people who are going to speak just for 5 minutes each, just to give us a little bit of a flavour of some of the stuff that's going on. And the first person I'd like to invite up is Joe Fowler. Is Joe, is someone in the room behind you? Okay. I always hate introducing someone who's got a faster PB time for half an hour than me, and I told Joe is an incredibly good runner. He's also head of commissioning for adult services for the city. Probably holds the biggest budget of anybody in the room, I would have thought. So it's great to have Joe coming up and talking about how he sees this activity involved in his area.
Hi, good afternoon, and I'll start off 5 minutes as quickly as I can. As introduced, I'm the Director of Commissioning at Sheffield City Council. I'm responsible for health and social care commissioning. Yes, it is a big budget, just reminded me quite how daunting that is. But also the Council's housing budget, the HRA, how we spend, Council tenants spend in the 30-year business plan on that. It's actually quite relevant to some of the stuff that you discussed, but that's not what I'm going to discuss now. Me and physical activity was my first bullet point. I discovered physical activity briefly at school and forgot all about it in a kind of whirlwind of drinking and partying and generally enjoying myself for 10, 20 years. And then when I hit my midlife crisis, which I quite happily admit is what happened, I decided I need to get myself into shape. I did start running, and I've spotted at least 2 or 3 people in the room that I see out and about when I'm jogging around town or indeed at races, because I got a bit obsessed and started getting competitive, and that's what motivated me. It doesn't work for everybody, but it did for me. Why am I here? I'm here because as a council, as a city, and as people are looking at the health and social care system and how we make it work, and we have a fundamental interest and ambition and vision around a city that is well, is safe, is where people live independently and happily. And who couldn't say that in any town or city in the country? Who are lots of happy, smiling people walking around enjoying life and talking to each other, being mutually supportive and enjoying great health. Of course we do. But, of course, the challenges that we face as a city that mean that that's actually not just a kind of a nice ambition, something that we should aspire to. It is actually something that we need to push towards very aggressively. There are challenges in delivering services with less money, with an increasing population, with an ageing population, people with more complex needs. That means that we're currently spending a lot more money every year, a lot more money than we did the previous year and so on. And those of you who read the papers will know that in social care alone, we're at least £11–12 million forecast overspend for this financial year. These are problems that are now, and those problems get bigger and bigger the further you look into the future, and the more money, to be frank, is taken away from the budgets that we use to meet people's needs. We currently have around 10,000 people receive formal support from social care in Sheffield. That's helped with day-to-day living, it's helped with getting about, it's helped with accessing activities, it's helped with basic care. That position, as I said already, is not actually currently sustainable and gets less sustainable with future years. Now don't get me wrong, there's a lot that we can do to make sure that the care and support that we provide people in Sheffield is provided better, is more cost effective, is value for money, meets their needs in a more personalised way and so on. But to be frank, we need people to be in better health too. We actually need to meet somewhere in the middle. We do need improved services that do commission around health outcomes and get people active and so on and so forth. But we also need people to be better, people to be more independent, more safe, more well, more able to stand on their own 2 feet. And we know that that isn't a social care ambition, that's an ambition that needs to be embraced by the city. One of the things that we've been using a lot around our commission plans this year and looking and scratching our head about the future is some of the 5 ways to wellbeing, which I'm sure some of you, being, I was one that became preaching to converted, here we are, around 5 ways to wellbeing. people being connected to each other, people being physically active, people having meaningful employment and training, and so on. I need to go through the list with you, I'm sure. So we do recognise not only that we have a role in the health and social care system in helping people be active. I'm literally running, not literally running, driving unfortunately up to Fowler in 2 minutes to meet with the Health and Social Care Trust to discuss a more creative care plan for people with mental illness, and one of the key components of that is physical activity. We also need the city as a whole to embrace physical activity, to provide the opportunities to do it. I think there's a few council people in the room. How many more minutes exercise do we do now when we have an office at the town hall and an office at the mall? I get an extra 15 minutes a day running up and down the mall. I quite like it, some people don't. But it does get people active. Okay, thanks Rob. So yes, there's more that we can do in the health and social care system to help people and encourage physical activity. But actually there's more the city as a whole can do to help out and to help people stay well and stay independent, so that we can hopefully cope with some of the pressures that we're facing both demographically and financially in the future. That's as much as I want to say.